So, good evening and welcome to our virtual program, Back to School Anxiety and Reminders. We are grateful to have Drs. Ulrich View and Alyssa Rios. Dr. Ulrich View is double board certified psychiatrist in child, adolescent, and adult psychiatry. He completed his undergraduate degree at Cornell University, his master's in human nutrition at Columbia University, and his medical degree from the Philadelphia College of Osteopathic Medicine. He has completed a family medicine residency at New York Medical College and his psychiatry and child and adolescent psychiatry residency and fellowship at St. Luke's Roosevelt Hospital Center. He is the founding psychiatry residency program director at Garnet Medical Center, as well as the former chair of the psychiatry department. Dr. View is currently the director of child and adolescent psychiatry, education and training at Hackensack Meridian Health, Hackensack University Medical Center, and has a private practice in Rockland County. Dr. View has held academic appointments at Harvard, Columbia, Mount Sinai, Meharry, and Touro College of Osteopathic Medicine. Dr. View has served as president of the West Hudson Psychiatry Society from 2021 to 2023 and is the book editor for the Journal of Muslim Mental Health. Dr. View is the current American Association of Directors of Psychiatry Residency Training, the Justice, Equity, Diversity, and Inclusion Chair, and serves on the editorial board for academic psychiatry. Dr. Alyssa Rios is a general pediatrician at Metuchen Pediatrics, where she sees children from newborn to 18 years of age. She completed her training at NYU Tisch Bellevue Hospital and has been with the Hackensack Meridian Health Network since July of 2022. So at this time, I will turn it over to Dr. View.
Good evening, everybody, and thank you for joining our discussion. The goal of today is really to have an honest discussion on anxiety that many of our kids face. And let's face it, it's not just our children, but it's us as well as adults. Can you forward the slide? Yes. So first of all, I always like to start this off. This is from Surgeon General Dr. David Satcher. And he basically said that there's no health without mental health. And this is a key thing because as we prepare for our kids to start school, there's a lot of thoughts that we have. There's a lot of concerns as parents, as guardians, we may share. And the reality of the matter is that anxiety can be a positive thing. What do I mean by that? What I mean is that when you have a certain amount of anxiety, that can actually lead you to study hard. That can lead you to take school a little bit more seriously. That can be a motivating factor. The thing that we're concerned about, though, is when the anxiety leads to maladaptive behavior. It leads to a lot of stress, and it leads to an inability to actually function. So I think it's very important to kind of discuss the difference between what is healthy anxiety as compared to what is not healthy. With that said, even if something is not healthy, we still have the solutions, we still have the answers to help that. So it's not necessarily a negative situation. Okay, please go to the next slide. So the World Health Organization, just to show how this is kind of like a common issue. Nearly 1 billion people on Earth has some type of mental disorder. Depression is a leading cause of disability worldwide, impacting about 5% of the world's population. People with severe mental disorders like schizophrenia tend to die as much as 20 years earlier than the overall population. 1 in every 100 deaths is by suicide, the 4th leading cause of death for young people aged 15 to 29. Now, this data can be very intimidating, but my perspective, the reason why I present this data is for us to be able to feel comfortable addressing issues of mental health. And the reason why I said this is because, as was said before in the introduction, prior to going into psychiatry, I was a family medicine doctor. And the reason why I chose family medicine was because as a med student, I was torn. I was torn between being a primary care physician and also mental health. In retrospect, doing the family medicine residency was one of the best things that I've ever done in my life. Why? Because I was able to see people from a holistic perspective, and I was able to see the community at large. So hence, one of the issues that we have with these scary numbers is the reality that many people are not getting mental health. They're not getting the support that they need. So by making sure that we have a honest discussion, that will itself help solve the issues that we're dealing with. Please, next slide. Okay, so I know this could be a little bit of a intimidating slide, but I personally like it. It's kind of cool. I mean, it just really goes into the beauty of the brain. And what are we actually talking about? Like, are we talking about anxiety? Are we talking about depression? What aspects of our body is really being focused on? So basically, when we talk about anxiety, when you talk about depression, these are basically higher reasoning, executive functioning issues, specifically from the frontal cortex. Frontal cortex is the front part of our brain. So what are the nine functions of prefrontal cortex? What is empathy? The ability to feel for another person. Insight, understanding what is going on. Response flexibility, emotion regulation, body regulation, morality, intuition, attuned communication, fear modulation. So that's basically the front part of our brain. The limbic system, which is the primitive part of the brain, that is what we refer to as the fight or flight response. Thinking, am I safe if I'm not safe? Quote unquote emotions basically live within the limbic system. And as you can see, the limbic system and the prefrontal cortex are relatively close. There's kind of like a highway between the two of them. So ideally, you want these two aspects of the brain to be functioning ideally effectively to really get the full benefits of what you're trying to accomplish. Next slide. So one of the things that we want to talk about, specifically about solutions of anxiety and depression, basically the topic that we want to address today. Ways that we can make sure that our body is functioning in an optimal manner is one, understanding behavioral health, taking your mental health seriously, being honest with your provider, being not isolating, having a very strong social support. Diet. Diet is so important. And in many ways, many of the disorders that we have, it's due to a diet that's not really optimal. I mean, if you look at certain medical issues, whether it's type 2 diabetes, whether it's certain cancers, it is really linked to a faulty diet. So again, even having a healthy diet, that can actually help the way you process your emotions, the way you interpret things that are going around you. So again, having a healthy diet is very vital for sustained mental health. Exercise cannot minimize it. And also, there was a study in Europe that basically spoke about how do you minimize depression? How are older people still being able to be very, very, very functional? And basically the study said, and it came out that all you need is about 150 minutes of aerobic exercise a week. Think about that, 150 minutes of aerobic exercise a week. That can include, is not limited to having a brisk walk. I mean, some, maybe even walking with your family, walking with your loved ones, jogging, riding a bike. It doesn't necessarily have to be to the point of actually going to a gym, because oftentimes we have these great, New Year's resolutions, but again, we don't necessarily follow through them. The key thing is to start something that you can actually complete and you can maintain. So that's one of the things when I talk about exercise, I talk about walking, doing these type of holistic things. Another aspect is meditation. Meditation is a really important aspect. And towards the latter part of my presentation, I'm going to talk about some of breathing techniques that we utilize. Of course, for some people, the reality is that medication may be needed. And there are a host of medications that we can use to help control anxiety, control depression. I will say that these medications can be most most effective or most utilized when you are unable to maintain your daily activities of daily living. Um, I will say as a child psychiatrist, my experience, kids, teenagers view school similar to the way adults view work, meaning that a lot of adults, they take a lot of pride in the work that they do. I mean, their jobs can pretty much be their identity. Similar to for kids when it comes to school. Usually kids that are doing poorly in school, there may be another factor that's coming into play. Factors such as a learning disorder, untreated ADHD, untreated anxiety, or even depression. One of the key things that I notice if a child's truly suffering from depression, one of the first signs of depression for me when I'm looking at a child is, let's say I have a kid who historically has been an A, B student. That all of a sudden, one semester, the kid is getting C's and D's. What is that about? I mean, there may be a bigger situation that's going on. Relationships are very, very important. I mean, I can remember my mother would often tell me that you can say a lot. You can get a really good feeling of what a person is all about by the friends that that person chooses to hang around with. So it's very important that our kids are socializing with people that have similar goals as them. And also, just in general, it's very important to make sure that you don't isolate. But fundamentally, human beings, we are social people. So it's very important to be able to have relationship with healthy people that really can help you achieve your goals. And a team. I mean, we are a team, and understanding that aspect is a very important aspect of truly getting and galvanizing everything in regards to your activities of daily living. Next question. Next slide. So one thing I want to talk about. This is now I'm talking about the really serious issues, but I also think that this can be adapted to all aspects of anxiety and depression. And basically, this is based on this technique called dialectical behavioral therapy. Now, I often use dialectical behavioral therapy for many of my patients that are suffering from anxiety. And one of the things that we try to focus on, the four core skills of DBT is one, mindfulness. What do I mean by being mindful? I'm talking about being present in the moment, okay? Enjoying the moment, not necessarily worrying about the past, not necessarily focusing about the future, but just thinking right now, how can I take advantage? How can I enjoy the current situation that I'm in? So that's a part of mindfulness. Another aspect is distress tolerance. When there's a challenge, when there's a concern, how do we minimize distress tolerance? So one of the questions that was asked from our audience was, how do you deal with your child's anxiety during the first day of school? I can almost anticipate that my child's going to be very anxious during the first day of school. One of the things that you can do to minimize that distress tolerance is actually plan for that first day of school. Most schools are starting in September 7th. Maybe next week, take a drive around the school, try to problem solve how it's going to be for that first day of school, similar to what athletes do when before a major game, the day before, they'll do a walkthrough through the stadium. They'll do a walkthrough. They'll go over some key plays. So and you do that because it gives you an opportunity to kind of master the situation that you're about to get into. Interpersonal effectiveness, the ability to be able to talk to other people. How can you get your needs met in a healthy manner? So again, interpersonal effectiveness, telling your child, teaching your child, encouraging your child to feel comfortable speaking to their teachers, speaking to their guidance counselors, maintaining friends, not allowing themselves to be bullied. And if that's the issue, then being able to get the appropriate people that can help minimize those awful situations. And the fourth thing is emotion regulation. How do we maintain our emotions to the point where we're not too manic or too high per se, but by the same token, we're not too low, kind of having this even keel. And once you can kind of control these four aspects: mindfulness, the stress tolerance, interpersonal effectiveness, emotion regulation, that within itself will minimize anxiety. Next slide, please. Okay. Again, and as I mentioned before, there's acute stress, can have some positive attributes. The bottom line is that if you're walking in the jungle and you see a saber-toothed tiger coming after you, that's going to be a pretty anxious, stressful moment, and you're going to need some adrenaline to get out of that situation. So for a short period of time, that's really great. Concerns that we have is the chronic stress. And again, there can be many scientific explanations for that, but long-term chronic stress can cause a lot of issues. But with that said, even that of the chronic stress, as I said before, there are techniques to help lower that. Next slide. Okay. And again, core mindfulness, as I said before, is the ability to be aware, being focused in the present instead of worrying about the past or future. And one of the things that I like to use, and I'll end basically soon, but one of the techniques that I find that can be very, very helpful is to sit down, have your two hands on your knees, and really focus on your breathing. Focus on the breathing in, then out. In and out. And this actually works. So today, I saw one of my patients, a young boy with autism. Has a lot of issues with making friends, and he was very, very anxious about the start of school in 2 weeks, to a point that he's had some nightmares. And during our session, I said, hey, let's take a break. Let's just focus on the breathing. Let's focus on being mindfulness, being in the moment. And you could tell after the exercise, which we did it for about 3-4 minutes, you could see the young person, their face being calm. You can almost see the stress melting away from them. And that was the actual words that they utilized. So a lot of these techniques, we have it within ourselves to help solve them. Next slide. Okay. And with that, I would like to give the floor to Dr. Rios, and then at the end, we'll come back and we'll answer the questions from our audience.
Thank you so much, Dr. View. Now that Dr. View has discussed back to school anxiety and things that can be done as parents to help with that, I just wanted to take a little extra time to discuss other back to school reminders and other things that can be done to make sure that your child has a successful year in school. I think you actually went too far up. If you could just go one back up. There you go. So just to break it down, in this part of the presentation, we'll be talking about sleep, such as how much sleep is enough for your child, as well as techniques to ensure that your child is having a good night's sleep. We'll be talking about healthy eating and physical activity and the importance of these in making sure your child performs their best while at school. We'll be talking about building good homework and study habits for your child when they come home from school with assignments. And we'll be talking about the importance of seeing your pediatrician for things like school and sports physicals, as well as making sure that your child is up to date on all of their vaccines. Okay, next slide. All right, so first, the importance of sleep. We all know that sleep is important. For school-age children, getting a good night's rest allows them to have an improved mood and the ability to focus while in school. It's also essential for forming and maintaining memories of what they learned during the day. Children and adolescents who don't get enough sleep have a higher risk of obesity, diabetes, injuries, poor mental health, and problems with attention and behavior. Establishing a regular sleep schedule prevents fatigue, exhaustion, and daytime drowsiness. According to the Academy of Pediatrics, how much sleep a child needs depends on a child's age and activities levels. So for preschoolers between the ages of 3 to 5, they require about 10 to 13 hours of sleep. For children between the ages of 6 to 9, they should be getting around 9 to 12 hours of sleep. And for teenagers between 13 to 18 years of age, they should be getting around 8 to 10 hours of sleep. So for example, if you have a teenager who's 15 and who needs to get up by 6 o'clock in the morning, then based off of these recommendations, he or she should be going to sleep by around 10 o'clock at the latest. Conversely, if the child is 10 years old, then his or her bedtime should be around 9 p.m. And if the child is preschool age, then their bedtime should be around 8 p.m. at the latest. Now you might be saying to yourself, well, that's all fine and dandy, but how do I get my child to be on a regular sleep schedule in order to get this recommended amount of sleep when they've been going to sleep at midnight for the past 2 months for summer vacation? Well, the answer is you need to start now. Figure out what time your child needs to wake up to get ready for school, and then, depending on the age of the child, determine when their bedtime should be. In the weeks leading to going back to school, which would be around now, have your child wake up 15 minutes earlier and go to sleep 15 minutes earlier than they had been during their summer break. Continue to adjust every few days, going down by about 15-minute intervals at a time until they're at their desired schedule. Next slide. Now, if your child is having difficulties falling asleep, there are some sleep hygiene techniques that we recommend to ensure that your child is getting a better night's sleep. Number one, establish a bedtime routine. This can include things like taking warm baths, reading individually or with a parent, journaling, or meditation. Essentially anything to calm down the mind and calm down the body. Number two, exercise regularly. Physical activity is proven to help people of all ages fall asleep faster and stay asleep, as well as reduces overall stress levels. Most children need at least 1 hour of exercise per day. You do want to make sure, however, that your child avoids any vigorous activity within 2 hours of bedtime, as this can just have an opposite effect and make it harder for them to fall asleep. Number three is that we actually want to avoid too many extracurricular activities. Extracurriculars are great, but free time and rest are also important to a child's development. So you want to make sure that their schedules aren't too packed to not allow for that good night's sleep. Number four, stop all electronics before bedtime. This is because the electronics emit something that's called a blue light, and it tricks the brain into thinking that it's daytime, basically by suppressing the melatonin, making it harder for you to fall asleep and harder for you to get restful sleep when you do fall asleep. So to stop this from happening, it's important to stop all electronics at least 30 minutes, but ideally an hour before bedtime. Number five, you want to limit napping. I know napping during the day can seem tempting, but it's linked to poorer sleep and shorter sleep at night. So you want to avoid that if at all possible. If your child just really needs a nap, you want to make sure that's no more than 30 minutes. And for our older kids, we want to make sure we're avoiding any caffeinated beverages like coffee. And then when it comes to the bedroom itself, it's always important to keep the room dark, make sure the room is cool, eliminate noises and keep the bedroom quiet, and only use the bed for sleeping. And that's just so that the child associates the bed with sleep. If for whatever reason you do all this and your child still isn't able to fall asleep within 20 minutes, then have them come out of the room and do a quiet sleep-inducing activity until they're ready to try again. Next slide. So equally as important as sleep is making sure that your child is eating a healthy and balanced diet. Healthy eating in childhood and adolescence is important for proper growth, development, and prevention of various health conditions. As children prepare to get back into the school routine, it's important that they're eating the right foods to fuel their day. These tips will help your child thrive and start the school year off right. So first and foremost, a child needs to eat a healthy breakfast. Children who eat nutritious breakfast perform better in school because they're able to concentrate more and have increased energy to make it through the day. Eating breakfast is also associated with improved memory, better test grades, reduced absenteeism, and improved mood and behavior. When preparing for breakfast, you want to make sure you're incorporating at least one item from each of the following 3 food groups. So you want to make sure you're having your whole grains, such as whole wheat bagels, whole grain cereals, oatmeal, or whole grain toast. You want to make sure you're having some type of protein, such as eggs, meat, or poultry. And you want to make sure that your child is having some type of fruit, and either fresh or frozen fruit would work with that. Next. Secondly, you want to make sure that your child is having a healthy lunch. Whether your child is eating a school-provided lunch or bringing lunch to school, you need to focus on nutrient-dense meals that will sustain them throughout the rest of the day. To create a healthy lunch, include one of each food group. So you want 1 protein, 1 whole grain, 1 fruit, 1 vegetable, and 1 dairy choice. Pack plenty of water for them and try to stay away from any sugary drinks. And finally, next slide. When they get home, you want to make sure that you provide them with healthy after-school snacks. Whether your child is going to an after-school activity or getting ready to do homework, a healthy snack before dinner is important to keep energy levels up. Try to incorporate fruits and vegetables as healthy snacks instead of highly processed snack foods like chips or cookies. An apple with a teaspoon of peanut butter, some veggies with some hummus, or even just a cup of yogurt are all healthy snacks that can help satiate hunger without spoiling their appetite for dinner. Next slide. And as both Dr. View and I have alluded to previously, physical activity is also an important factor in making sure that your child succeeds in school. Being physically active can help reduce anxiety and can even help a child focus better when in school. Experts recommend children get at least 60 minutes, of physical activity each day. And even if your child's not a big fan of sports, that's okay. Running, walking, or even dancing to their favorite music all counts as physical activity. Okay, next slide. So once your child gets home, you want to make sure that you're building good homework and study habits. While there's no definite answer for how much time a child should be spending on homework, the general rule is that they should be spending about 10 minutes per grade level. So for example, a 3rd grader should be spending about 30 minutes, 6th graders should be spending around 60 minutes, and a high schooler should be spending anywhere between 90 minutes to 2 hours. In order to ensure that students are using this time most effectively, there are some good homework and study tips that you can enforce as parents. So 1, make sure that you schedule ample time for homework. You want to make sure that your child has enough time in his or her schedule to complete all assignments. Build this time into choices when participating in after-school activities. Again, as much as we encourage after-school activities, we want to make sure that children have enough time to do their homework. 2, you want to create an environment that's homework friendly. And that can be a consistent workspace right within the bedroom or another part of the home, but you want to make sure that it's quiet without distraction and promote study. Number 3, establish a rule that TVs and all other electronics need to stay off during homework time. And if for whatever reason the child needs to use the computer during homework, make sure that the computer and the internet use is being supervised by you. Then make sure that the child takes breaks. It's easy to get eye fatigue, neck fatigue, and just brain fatigue while studying for an extended amount of time. It may be helpful to close the books for a few minutes, stretch, and take a 5 to 10 minute break periodically when it's not too disruptive to the studying. And finally, if your child needs extra help organizing their homework, create checklists and timers to help your child stay on track, and also monitor their progress as needed. Now, if you're doing all this, but your child is still struggling and you feel that he or she would benefit from extra services, then please submit a request to your school for an individualized education program or an IEP so that they can do a formal evaluation. Next slide. And last but not least, see your pediatrician. School-age children need to be seen at least once a year for their annual physicals. So it's important that if your child hasn't been seen within the past year, they should get that physical done as soon as possible. Not only will pediatricians complete a full physical exam and obtain any blood work necessary, but if your child is planning to do a sport in school, it's also important that a full sports physical also be done to ensure that they're physically safe to play that sport. In addition, children need to be up to date on all vaccinations when entering school. Schools are great, but unfortunately, they can also be breeding grounds for a lot of different diseases. So it's important to check with your doctor to make sure that your child isn't missing any vaccines necessary. Next slide, please. And then this last slide is just a quick list of some of the mandatory vaccines that children need when entering school for the first time, as well as some vaccines that children also need as they get older in school. As we start entering the fall and winter seasons, we also recommend that children get the flu and COVID vaccines to prevent against infections. Next. And that's it.
All right, thank you so much, doctors. That was very helpful and informative. So at this time, we are going to do some questions. All right, so the first question is, what is the best way to deal with college homesickness?
Perfect. Well, first of all, I would like to thank all the audience that actually gave these questions, and I also want to acknowledge two medical students that's currently rotating the child and adolescent department, student Dr. Emily McAllister and student Dr. Krista Ramin. And the reason why I mentioned those two students is that they actually looked at all the questions and they all really prepared good talking points. So I just wanted to actually acknowledge them. So the first question, what's the best way to deal with college homelessness? The first thing for the parent is to kind of figure out what is life. I mean, how will life be without these kids per se? Because the thing about college is that not only is it a significant achievement, a life change for the child, but it's also a big deal for the parent. I mean, empty nest syndrome is real. So looking at ways to kind of look at the new opportunities that you may have, enjoying the fact that your child is entering a new chapter of their life, but also by the same token, that within itself can be a very anxiety producing moment for the family. So I guess the key thing is to continue talking, making sure that no one is feeling isolated. One suggestion that was mentioned was that if there are specific foods, certain foods that the student used to enjoy from home, actually setting that food, frozen meals. I mean, I think all college students appreciate a good dinner. So, having meals that are very reminiscent of how life was at home during that time can be a very nurturing, be a very nurturing event.
And just to kind of piggyback off of that, I think when children go to school or when they're going to college for the first time, no matter how excited that they are, it's a new experience, right? They're away from their parents, they're away from their friends, they're responsible for themselves for the first time. So as excited as they are, it can be very overwhelming, and it can, be something that they have to deal with. It's an adjustment that they have to make. So I think as parents, just making sure that you're as supportive as possible, like Dr. View said, with the meals, or just making sure that you call them every day, make sure that they know that you're there if they need to talk, if they need anything at all, and encourage them to go to clubs and different hobbies, things that they're interested in school, because the more friends they make and the more time they spend with other people in the school, I think it'll help them with their feeling less homesick and less anxious as well.
All right. The next question. What would be considered a sleep encouraging activity to try if my child doesn't fall asleep 20 minutes after being in bed?
So that would be more of like the bedtime routine. So if, let's say, for example, if the child hasn't taken a shower, for example, or showering calms them down, making sure that they take a shower ahead of, to calm down their body. Sometimes reading is a good alternative for that. For some children, if you're listening to music, but something classical music, something calming, there are meditation apps that they can also use just to kind of help them sleep as well.
All right. The next question. How to respond when kids get frustrated with homework or they have difficulty settling in and getting it done?
Well,
So,
I think the
go. You can go ahead. Definitely.
Dr. Rios, you can go. You can go, Dr. Rios.
Oh, okay. So in terms of when they're frustrated with homework, first you need to make sure that their study habits and everything is set up well for them to study. So kind of what I touched about before, with making sure that they have a quiet space, that they've recently had a snack so that they're not hungry. And if you're really optimizing all of that and they're still struggling, then I think the next part is to look at why they're struggling. Is it that they're not understanding the material? Is it that they do understand it, but they can't focus on the material? And then based off of that, you can work with the child's teachers or even their pediatrician to really determine what their next step would be in helping with that frustration that they're having.
And I also would like to add to, because I think Dr. Rios made a really good point, great point, is that we need to try to first determine what age is this happening. Is this a 5, 6-year-old, or is this a high school student? And I think one of the things that you want to kind of rule out is that, is there a possible specific subject that they're having a difficulty with, and is that due to a possible learning disorder? So if they're doing well in all these other classes, but for whatever reason they're having a tough time with math, then you have to kind of wonder if there's a specific issue with that. And that is the time that you actually go to the school. You can actually, look for a 504 plan, get some possible psychological testing. Also, one thing that is very common and that's often underdiagnosed, contrary to what public opinion is ADHD. 20% of all children and adolescents have identifiable mental health illness. Out of that 20%, only 20% is getting any form of treatment. So oftentimes I'll use a lot of scales to kind of ascertain what's really going on. So for example, when it comes to concentration, an issue like Vanderbilt scales can be very helpful, where they're actually doing a scale, filling out the scale from the parents in home, but also the school teacher actually fills that as well. So you get a better understanding, a more 360 viewpoint of what's happening with the child.
All right, thank you. The next question is, how should my child handle bullying and or racist remarks while in school?
Yeah.
Who wants to take that one?
It's kind of interesting because, as I mentioned before, this was something that in preparation for tonight's meeting, I was talking to the medical students that are rotating with us, and this was a question that a lot of them really it really galvanized a lot of discussion. And I think the first thing about it is, first of all, do not internalize that behavior. Okay, don't necessarily, accept it. A second thing is to be comfortable. Find somebody that you feel comfortable talking to regarding the bullying, whether it's a school teacher, a school counselor. Feeling confident that you're not by yourself. So I think those were one of the key take home points.
Yeah, and to just go off of that as well, I think for younger children, especially first going into school, talking to them about bullying ahead of time and letting them know that bullying is never okay. And that if they are ever in that situation, that it's important to talk to an adult is really something that, just to start off with. And then you can come up with a plan of what you would do if they ever had an incident where they were being bullied. And as Dr. View said, when they come to you, it would be important for you to go to your school and speak to someone there that can better address that issue and make sure that the bullying doesn't continue to occur.
Thank you. Next question is, let me see. My 6-year-old grandson started playing with her tongue and lips. He does it while watching TV or sitting alone. Not sure if it's anxiety, but can't stop on his own. He says he doesn't even know why he's doing it. What would be the best way to help stop this habit? And he's already got sick one time, and it could have been from dirty fingers in his mouth.
Yeah.
So to me, that sounds a little bit more behavioral than anything else. So the best thing that you can do in those types of circumstances is to address it, let him know that he's doing it, and explain to him why it's not the healthiest to put his hands in his mouth. But don't make him feel bad for it. If you see it happening, just mention it to him, but try not to kind of shame him for doing that. And then try to find other things that can be done instead. If he's really fidgety or he needs to move his hands, maybe a fidget spinner or some other thing to kind of keep his hands occupied, which should be enough to kind of help with that issue, with that situation.
Okay. The next question, any tips or tools for the fear of forgetting things or misplacing things as the school year starts and more kids are around to accidentally take or move them from their place?
Yeah, well, so one of the things about that, because that can be a sign of multiple issues, whether it's an ADHD component, it could also be an issue of anxiety, of being afraid. So I think one of those key things is to make sure, again, as it was mentioned, having the fidget spinner, just being kind of aware. I'm a big supporter of using checklists. So I think that's also a way to make sure that things are being done appropriately.
Okay, the next question, how can I recognize the signs of social anxiety in my child, and what steps can I take to help them cope with it in a healthy manner?
Well, as far as the social anxiety, again, we need some more information on that. So the question is it social anxiety in reference to going to school? Is it social anxiety in reference to interacting with other kids? I think a lot of it that we need some more information regarding what is meant, what is being asked.
Okay. I mean, can we, I guess, say for just like an example, if it is the school atmosphere?
Yeah, I think one of those things about the social anxiety is, again, trying to understand, trying to making sure that your your child has a solid peer group that they have. Another thing that I would also want to look at is that oftentimes kids will say that I don't want to go to school, but as soon as they go to school, things they get really comfortable. So I'd also look at other aspects. I would want to see is a child going to bed? Are they getting enough sleep the night prior to that? Are they able to have a good breakfast? So looking at some of these other external factors that within itself can kind of help alleviate some of the anxiety that they may be exhibiting.
Okay, next question. What are some practical strategies I can use to support my child in building their self-confidence and self-esteem?
One of the good things about extracurricular activities is basically encouraging your child to pick a hobby, to pick some type of event that they enjoy. So, for example, sports can be a great way to increase self-confidence. Playing a musical instrument, these type of things, even things such as community service projects. I mean, if you're a part of a community that actually gives back that takes community service projects very seriously, that within itself are things that can kind of help self-esteem. Understanding that you're necessarily not by yourself, but you're actually working with a community at large.
Yeah, and I would also say that as parents, I think it's very easy sometimes when your child is doing something wrong to kind of discipline them in that way. But it's also really important to praise your child when they do something right. Ask them about their day, talk about the positive things that happened in their day, and then continue to praise them about the good things that you see that they're doing. And the more they get that positive reinforcement, the more it'll help with their confidence and their self-esteem.
Thank you. The next question, how can I communicate with my child about their weight concerns in a sensitive and positive way, focusing on overall health and well-being?
So I always tell my parents when they come into the clinic with that question that it's really important not to focus on the number. It's important to focus just on eating healthy and making healthy choices and physical exercise, but not so much on the number on the scale. So when it comes to healthy eating, bring your children along. Let's say if you're going to a supermarket, make it a family event. Talk about what's healthy, what's not. If they're older, you can look at nutrition labels and see what makes it healthy and what makes it not healthy. But more importantly, just make it fun. Same thing with physical activity. If you have a child who doesn't really like moving around very much or is attached to their screen most of the day, try to do things as a family together. It could be walking in the park, it could be playing frisbee, but just making sure that they're active and more importantly than anything, making it fun for everyone.
Great. The next question, how about when a child is just too hard on themselves, expecting too much of themselves? And when you tell them that mistakes are okay and they don't have to be perfect, it's just not enough for them to hear. And also tips for dealing with the school pressures and performances.
I'll leave that to you, Dr. View.
Yeah. Again, I mean, a lot of you kind of have to break it down to specific situations, because I think, overall, the general anxiety can be, as I said before, it can be a positive thing, but the anxiety itself can actually help motivate people to reach heights that they've never reached before. But I guess the key thing we have to kind of determine is when does this anxiety, when does this pressure lead to actual, for lack of a better word, paralysis? And when that happens, this is when you may have to kind of consider seeking help. And maybe that help can come from the form of a therapist that does CBT, cognitive behavioral therapy, also that can even be a possible need for possible medication management. I'm not necessarily saying as at that point, but it's kind of understanding what's going on. And also, I also think it's important to also look at what is the family's perspective or experience with these type of things. So the question that I'm at that comes to mind when hearing this is this type of anxiety very common amongst the parents? So do the parents themselves have some type of struggle that they're experiencing? And if they've had that same anxiety, what are some of the things that they have done to help alleviate that? So I think understanding it from a 360 perspective is vital.
Okay, great. The next question, what to say and how to calm a teenager that is having an anxiety attack, such as hyperventilating and crying hysterically?
Oh, I mean, I think, the mindfulness techniques is very important. Just really encouraging breathing, being able to relax, being able to sit down in a safe space. I think these are really important techniques to use when there's a panic attack.
Okay, let's see. We probably have time for just a few more questions. What is the best response for a parent to have when their child is having school refusal in the morning, crying that they don't want to go? And if they're refusing not to get ready, won't get out of bed. So what are some tips to help with this?
One tip to have is, again, try to get a better understanding of the dynamics within the household. Again, did the child was he able to have, or she able to have a good night's sleep? Were they able to have a solid breakfast? You also want to know, is there an actual issue with a specific class that they're having? So is there some possible diagnosis, i.e. such as ADHD or learning disorders that have not necessarily been picked up, and as a result there's this a large amount of anxiety in reference to actually going to school.
All right, thank you. The next question, let's see. How do you encourage a 7-year-old to introduce herself to other kids and ask them to play with them?
Yeah, so the best way to do that is to kind of model that exercise. So let's say you with your child, and you guys are at a playground. Maybe it'll be helpful for the parent to also start the dialogue with another parent, and that within itself can be a way for the children to talk. Another thing I would probably focus on is, instead of focusing on a bunch of children at one time, just try to pick talking to at least one child. That within itself may be helpful as well.
All right, I want to thank you, Dr. View and Dr. Rios, for such an informative and helpful presentation. I know myself, having 2 high schoolers getting ready to go back to school in a few weeks, that this was very helpful. So I hope that everyone else found this helpful. So thank you all for taking the time to join us tonight. Please watch your email for an evaluation of the program and take time to fill it out. We'd love to hear from you, and let us know if there's other topics of interest. The link for the recording will also be sent out. And we have other parent forum webinars that'll take place this year and into next year. So the next one is on Positive Parenting 101 on September 28th. Please feel free to visit our website, or you can call our 1-800 number, 1-800-560-9990, to register and find out more information about these upcoming programs and others. So thank you again, everyone. Thank you, doctors, and we hope that you all enjoy the rest of your evening. Take care.
Thank you.
Thank you.